Let me share my slides for today. I like to keep it short and sweet. Let's start the journey. So, 3D Organon webinar for today. I hope I'm audible to everybody and the slides are visible. Anybody in the audience can please put in the chat, or would you like to speak? It's up to you. Am I audible? And the slides are visible, I suppose. Okay, so
yes.
Thank you very much. Thank you. So okay, so the title which I would like to speak is the lived experience. It's the stakeholders' lived experience, one of the stakeholder being the faculty who uses the 3D Organon Anatomy application to get the CLOs that the students need for their specific courses. And the other stakeholder is the student who is going to learn through play. So these are the two lived experience that I'm going to share with you. So I hope these are the two outlines. One is the faculty reflection, and the second is the student's experience. So let me start by our story. How did we get in touch with 3D Organon? College of Health Science, Department of Nursing is a very new program in the University of Fujairah. It started in the academic year 21-22. So we started in the fall of academic year 21-22, which had one batch of students known as cohort 1A, which is a fall intake, and the second batch came in the spring semester, known as cohort 1B. So the samples who responded to the survey, which we sent out through Google Forms, are these two batch of students. Google Forms were Likert scale. There was a 5 or 7 questions, and they responded to these questions. So cohort 1A had 2 exposures. They have one course, which is Anatomy 1, which is APH 1123, which includes systems like the nervous system, the endocrine system, the muscular system, the skeletal system. So Anatomy 1 is a prerequisite for Anatomy 2. So Anatomy 2 consists of the cardiovascular system, the digestive system, the blood and its elements. Then we have the lymphatic system, the urinary system, all the systems divided into 2 courses. So Anatomy 1 in the fall semester, the students in cohort 1A were exposed to VR. In the spring semester, Anatomy 2, they were exposed, but cohort 1B was exposed to the spring only, to Anatomy 1. So there are 3 exposures which we are going to talk about, but it is a compiled result. That's about the students, the College of Health Sciences, Department of Nursing. And now the faculty who were exposed to the 3D Organon, 2 faculty were very quickly trained by the providers of 3D Organon, the leaders health group. So they were very, very, very supportive to our queries. Sometimes even during class, we faced some issues, and they were very quick to respond and help in troubleshooting. So 2 faculty received the training, me, Dr. Jobby, and Dr. Rock. So we were the 2 course instructors for the anatomy course. So both of us received training because this is a very important part of how to carry forward the technology. Having the technology alone is not enough. So as a faculty reflection, why we chose VR, why VR is important. As Mr. Tedros said, pandemic was a blessing in disguise, especially for one technology that we are using now, Zoom, and the other technology is VR, and many more technologies that we use daily. So one of the positives of the pandemic was a cadaverless anatomy education. Then the innate nature of the science, anatomy, we study 3D structures. We have 3D objects and 3D systems to study. So VR anatomy, 3D anatomy is an excellent tool to study anatomy. And the third point which I would refer is Z generation. I belong to the X or Y generation. We are all native, not native, we are immigrants to digital world. Whereas the students sitting in today's classroom are from the Z generation. They were born into this digital revolution and they enjoy the digital world more than us, and they know more than us how to play around with these technologies. So 3D anatomy Organon is an excellent tool for that. This also changes the previous notion of a teacher-centered approach to a student-centered approach. It initiates student-centered approach because the focus of focus of attention shifts from the teacher to the student. It also is an immersive learning environment where the student travels through the VR environment and he collaborates with it's a value, knowledge, skills, and values can be taught through VR. Collaboration is a value that we can teach through VR. So immersive learning environment facilitates the knowledge and skills. The collaboration, he asks questions to his colleagues, his faculty, his facilitators, what is this? He will collaborate more. And also, thanks to Vesalius, the great legend who wrote the first book about anatomy, most of the terminologies in anatomy are Greek and Latin. So non-native Greek and Latin speakers may miss the pronunciation of certain, for example, the biceps brachii. So I have heard some students pronounce it as brachii or brachii. So the right pronunciation is also enhanced through the VR because this is universally going to be used. So these are the faculty insights why VR is a to-go tool for anatomy education. These are all the positives. I will come to the lived experience where we had certain challenges and what actions we took about it. So what lessons we learned through VR by implementing VR in the curriculum? What lessons we learned and what challenges we faced, what actions we took for it. So operational challenges, we had some operational challenges. As we said, it was a short training. We could not solve some of the most simple things through that short training. So we requested the leader healthcare. They gave us a formal certified training in overview and introduction of 3D Organon VR so that we could face any challenges on the way. Secondly, we also got another certified training in troubleshooting during VR 3D Organon VR Anatomy use. So this was an excellent solution what was provided to us during actual. It's actually putting the learning experience on the ground so that we can work with a better way to solve the issues that may arise. Second was the cost of VR equipments, licensing and relicensing. So some austerity measures by the university. We had VR in the academic year 21-22. 22-23, we did not have VR because of our own financial austerity measures. So maybe we have to talk to the VR provider, 3D Organon or leaders, whether they can provide us with a package of more than 1 year relicensing packages so that we can fetch an economic package. So that maybe Mr. Tedros will address in the end of the speech, end of the webinar. Third one is some faculty or both of us, because of the regular use of VR, we felt kind of dizziness because of the constant exposure, because it's a 15-week course. 15 week, every week we are getting exposed 2 hours. And some students were feeling a little bit unsteady because immediately after the use of VR. So we started to screen the students. We asked them, okay, what is your previous exposure? Do you have any exposure with VR? If you have any experience and you have not felt any mild or moderate or severe, any symptoms, it's fine to go ahead to use. But do you know what was the response of the, irrespective of whatever experience they had, they still wanted to wear it and they still wanted to use it. So even the faculty, we all enjoyed it, even it's going to be for a small time. The next challenge we had was we had to create a VR sessions planned in the lab, a curriculum with the VR and a curriculum without the VR. For example, we could stand this academic year because a curriculum without the VR was planned. Also, we have, because of the nursing program, we have anatomy and physiology combined. The course name is Anatomy and Physiology for Nursing 1, Anatomy and Physiology for Nursing 2. So there is not only anatomy, there is also physiology. So 3D Organon is an excellent tool for anatomy, as everybody knows. But for example, for the circulation of the cardiac cycle, the cardiac conduction of the SA node, AV node, Purkinje fibers, or for the filtration, glomerular filtration. So for something which is a physiology based, we have to find a video based material, right? So these are some of the challenges and how we solve them for our particular curriculum. So this is all the faculty challenges, faculty reflection. Now we come to the second stakeholder, that is the students' responses. So we sent out a survey. We sent out a survey to the students after their fall and spring exposure. So we sent out a survey to the students and they rightly responded to us. So these are some of the graphs that you can see, a pie chart. The consent was made. There were 74 respondents out of 103 students we sent out. There were 74 people, 74 students responded. And this was to keep the confidentiality of the information. They agreed, provided us with consent to participate in the research. The age distribution very clearly, 96 almost from the Z generation. So this is, this is the reality of today. The classrooms are filled with students from the Z generation. The gender distribution, 73% of the category were female. I just before when I was preparing for this presentation, I looked at the difference in gender of how much is the VR used for play or for games between genders. So I saw a small percentage, 10% difference between male and female owning VR equipments, only a 10%. So this is because the gender distribution is, because we have more female intake. Nurses generally, females prefer the profession. So I'm not trying to divert the topic, but however, just adding a point that female and male prefer VR. So the third question was about the university registration number. So all the university registration numbers who participate in the research. And as I said in the introduction, we had 2 batches of students, cohort 1A, which is the larger batch, which has around 84 students, and cohort 1B is a small number of students, but the participation was much more in the cohort 1B, maybe because they were exposed 2 times in 2 semesters, and cohort 1B, 28.4% was people responded to the survey. So the nationalities in the distribution of students, almost all Middle Eastern, Asian are represented. We have wide variety of this: Egyptian, Emirati, Kosovo, Morocco, Omani, Syrian, Sri Lankan, Yemen, Palestine, Tanzania. So they are spreading the word to the world as well. So Arab Health is near. So they are taking the word. They are the ambassadors now. Now, those were the demographic questions. Now we come to the meat of the survey. Now we asked them the question, how helpful was 3D VR technology for learning anatomy? So around 80% said a great deal. So around 80% said a great deal, some 18% a lot. So you can take it as a positive response. 3D anatomy, 3D VR technology is very good for learning anatomy. So how effective was 3D VR technology in helping you learn the name and location of this anatomical structures? So around extremely effective, around 56.8%, very effective, 32, somewhat effective. So the distribution of 56.8 says extremely effective and 32. So I would still have a positive, I get a positive feedback from this because being a 3D science, 3D landmarks and locations are very effectively learned. After using the 3D VR technology assisted me to achieve better grades in anatomy. Has this, students, a success for a student view is their grades. So how many of them strongly agree that 3D anatomy has helped them to get grades? Around 50% of them agree that they got good grades through the exposure of VR anatomy, and agree says 36.5. So I would again say a positive response. What is the overall learning experience using 3D VR anatomy? 73% said it's excellent and very good, 16.2%. So again, positive response. Utilization, how often did you use 3D VR anatomy? So always, because this is a little bit spread distribution, because we have anatomy and physiology combined in the course. So based on the CLOs, we plan the VR. Only anatomy topics, we give exposure to 3D organon. And for the physiology topics, we base. So because there are two subjects involved, so always 21.6, yet usually 45.9. So again, I would say it is from my perspective, it is a positive response. The last question was, what are the major benefits of using 3D virtual reality in education? They have to choose any two. So any two options. So 52% equally shared the view that it makes it makes difficult concept easier to learn. The next opinion, which came close by, or almost 52, is get students excited and engaged about learning. So it's their experience of making things to learn simpler and excited and engaged. So these are the key words in learning. If we can get these words into their head, I think learning is going to cause permanent change. And the second place, reduce distraction during sessions, learn through play. Yes, the students, the Z generation, they are very exposed to VR in games, so they would like VR anatomy as well. So in conclusion, I'm concluding my presentation. The survey findings suggest that from the students, suggest that virtual reality plays a positive role in students' anatomy education. I would like to add just one more slide, which is we took this technology beyond to display it in the International Nurses Day celebration 2023. His Excellency Dr. Yusuf Muhammad Al-Shirkal was the chief guest. He himself was a trained doctor. He says, when I learned anatomy, I had burning eyes and running nose when the cadavers were used. Even me, I am a physiotherapist. I was trained using dissection dead bodies. So I had the same experience. So he was wondering how technology can, and why don't we have it everywhere in UAE? So this is what we were experiencing during the International Nurses Day 2022. Thank you very much, and I hand over the mic to Mr. Tedros. Thank you again, 3D Organon, for inviting me for this presentation. It's a great honor to speak from the Middle Eastern point of view and from the University of Fujairah point of view. I thank all the faculty who supported us during this initial period, and Dr. Kurin is here. I also warm-heartedly welcome her to this event. Thank you very much, everyone. Have a nice day. Please feel free to ask your questions. Thank you.
Hello. Dr. Jobby, that was wonderful. Thank you for sharing your experience and your insight on how on the implementation of 3D Organon within your nursing training program. Numbers, they say numbers speak louder than words, not just actions, and numbers are very indicative. Percentage, they don't lie, numbers never lie. And the percentage rates that you presented speak for themselves. I concur, and this is, and I'm pretty sure a lot of your colleagues from all over the world and other top tier universities that are using 3D Organon will concur with the percentages that you present to us. And it's growing, so we're pointing in the right direction. That's wonderful. We're not going to conclude the webinar yet. We have concluded in terms of presentation from Dr. Jobby, and now we can safely say that we can open the Q&A section. So please, don't be shy. There are some questions there. That's fantastic. This is a great opportunity to pick Dr. Jobby's brains and experience. Okay. So many Technico is asking, will there be a certificate of attendance? Well, I'll have a look at that one. I'm sure you've caught me off guard there, Manny. I'll see what I can do about that one. Hazem Einham is saying it's fine. I'm assuming that he or she were happy with so far how things are going and what they learn. So I'm taking that as a positive remark. An anonymous attendee, please do not be, a lot of anonymous attendees, please do not be shy. I'm an anatomy professor. Do you believe 3D Organon will help me and improve my student experience, Dr. Jobby?
Yeah. 3D Organon Anatomy is an excellent tool. One of them is one of excellent tool, but however, we cannot say cadaver can be replaced. It has, the silent teacher has its place, a big role. We cannot say that cadaver can be replaced by 3D Organon, no. However, when we look at, for example, the cadaver raises a lot of ethical questions, a lot of financial questions. To overcome certain areas of anatomy teaching and learning, we can use the VR efficiently. So my answer would be an added tool to anatomy teaching and learning. 3D Organon VR is an excellent one.
I think you've just answered also the second question from an anonymous attendee that says, will you recommend 3D Organon as a teaching and learning tool?
Yes, my answer will be yes. And based on two conclusions. One, the students from the Z generation, we have to tap on that. Second, anatomy being a 3D structural study, these 2 points are my go-to points because 3D Organon serves these two.
Fantastic. Another anonymous attendee is asked, do you believe, the questions are sort of like connected vessels. So, and you're answering, so inadvertently say, do you believe VR in general and 3D Organon in particular is the future of medical education? I think you've answered, but if you feel the need to supplement your previous answers?
Yes, technology is growing and getting better. So today's 3D organ version would be outdated in 1 year. So adding on, and the better version comes out, yes, adding 3D organ and anatomy in particular, or 3D anatomy in general would be an efficient tool, yes.
Okay. Hazem is asking, did you want to continue, Dr.?
Yeah,
Sorry.
just one more point. The 3D environment can be visited again and again. The cadaver, once you dissect it for 1 semester, you have to put a new request to ask for a new body to dissect again, or the other side, the other batch, the right side is dissected by one batch, the left side is dissected by another batch. So having 3D organon or any 3D anatomy equipment will help us to visit and revisit the learned CLOs again and again.
Right. I think that answers Hazem's question. Ask about, do you think technology can replace cadaver in labs for medicine and veterinary? Claire is asking, how did the teaching sessions run? It's a twofold question. Sorry. So it's just, how did the teaching sessions run? And was learning self-directed by students, or did you guide their learning? Okay,
so the 2 parts to the question. The lab session, not the theory session, the lab session had VR anatomy because we have a simulation lab. The Nursing College of Health Sciences Department of Nursing has a well-equipped simulation lab. Within the simulation lab, we have a section of basic sciences where we have anatomy, biochemistry lab, and the microbiology lab. In the anatomy lab, when the student comes for 2 credit hours, 1 credit hour of anatomy lab, the lab material is discussed. Later on, the students are guided. I'm now getting into the second part of the question. The students are guided. First, the facilitator wears it. The screen, the computer screen is cast to the flip Samsung 42-inch or 52 big screen. And there are 2 displays. One, actually we have 3 equipments, 3 licenses. So this rests on the table. The students can see it on this computer screen. Along with that, they can see the same on the big screen, the Samsung Flip television. So each student will manipulate. For example, if the CLOs for today is upper limb skeletal system, they learn the humerus, they learn the joints, they learn the clavicle, they learn the scapula, the ribs, all that, and they take turns. So first hour is first hour is the discussion, and the second hour is the lab. Actually, they learn by doing through guidance.
I would like to mention something here too. It's not 3D Organon's job or role or intention to replace that ancient relationship and role of the educator and student, which is a sacred relationship. It's what we do is to provide the right space, the right tools, and the right scene in a digital environment, immersive digital environment, right? For both the educator to facilitate their teaching and for the student to facilitate their learning. And in the new global world of teaching and learning and training, the feedback we're getting from the hundreds of universities, our university partners around the world, is that there is that student-centric approach now, tendency, where you mentioned it earlier on too also, where with the guidance of the educator, we do want our students today to assume more responsibility for this for their self-directed learning. The more they engaged by their own accord, the more fun it is, which is a very difficult subject, as you said earlier on. The more they feel engaged and motivated, the more control they take over their self-directed learning. Of course, always with the guidance of the professor. So I just felt the need to mention that too. So technology is not here to replace anyone, especially time-tested ancient relationships. It's there to give them, to help them with what they do, with the valuable services they do, whether it's teaching and learning. Ashraf Saleh is asking, hello, is asking, will 3D Organon work on new projects like working in veterinary? I think I can answer that one. Unfortunately, not from 3D Organon. I am aware of a demand. I was in the Middle East last year, this time, Ministry of Health, and I was inundated by people coming up to me and asking, do you have a VR solution, anatomy solution for veterinary? We do not, as such. We concentrate on human anatomy. There is a great demand. It's a very popular question. There aren't any companies yet, VR companies yet, that I know of that can provide virtual reality in veterinary. But that would be an interesting project for someone to undertake. So Ashraf, at the moment, unfortunately, from what I know, no. And I hate saying no, so, okay. Another anonymous attendee saying, how did 3D Organon change the way, no, sorry. Did 3D Organon change the way you teach anatomy? Sorry.
The teaching anatomy is the same. We just added the technology so that it can enhance. The ways are the same. The means are different. We just use another means to enhance the learning so that we get the benefits of immersive learning and collaborative learning, right? The ways are the same, but the means by which we apply the learning experience have changed.
Chris, an anonymous attendee. There are a lot of anonymous people, a lot of shy people amongst us today now. Which concepts in particular did the students find most difficult to understand, and the VR teaching especially helpful? So again, it's an interesting question. So
Yeah,
would you like me to repeat it? But which concepts in particular did the students find most difficult to understand, and the VR teaching especially helped? So.
Okay, that's a very, very interesting question and a very pertinent question, especially when we are in discussion. Actually, we did not do analysis of topic-wise. If we do a topic-wise analysis, then we have to see which topic was the most difficult and how helpful VR was. So we didn't, maybe the next project which I may embark on, or we can collaborate to learn we'll identify the most difficult topics, and then we will do VR special sessions with that and how helpful it was. Yes, that's a very good question. Thank you for asking that. You are muted, Mr. Tedros.
So, and there's another question from the same attendee, our guest. Does your departmental teaching include surface anatomy sessions?
The program that I am involved is nursing. So I think the person asking the question is from the medical background. So surface anatomy is skimmed through skin, superficial fascia, deep fascia, muscle, tendon, bone, all that is the way, that's the difference between medical science and other health professions. Usually, medical science teaches regional wise, head and neck, the upper limb, the lower limb, whereas health sciences teaches system wise, cardiovascular system, respiratory system. So that's the difference. So yes, surface anatomy, yes, but not to the extent the medical sciences teach.
Chris Vanderville, this is very nice. We have also the nice experience to use 3D Organon in high school for the STEM lessons. I can only recommend this to anyone. We used it in combination of dissecting the lung of a pig so they can also see the human lung. Well, that's very interesting. That's a use case scenario, actually. This is important. And I want, before, do allow me, Dr. Jobby. Equally important, it's very important to having a top tier, top quality anatomy application, and to be able to provide that to medical and healthcare professionals. Equally important to an amazing anatomy software, though, is also determining the exact use case scenario, how we can exactly and optimally fit the needs and requirements of an institution, regardless of level, whether it's university or vocational college or high school, whatsoever. And we take that very seriously also. And that's why we deliberate a lot with our partners, and we offer consultation. It's very important to determine exactly how they will use it for their benefit in their programs. And here I can see they've used it using the dissection. They've used the dissection of the lung of a pig, which they can associate with that of the human, which is amazing. So, Chris, thank you very much. That was a very nice comment. We are honored here at 3D Organon. Thank you. Dr. Sama Al-Mashaleh. Hello, Dr. Sama, how are you? He says, thanks, Dr. Jobby, for the valuable information and feedback. We believe that 3D Organon has a lot of innovative functionalities and features. But my question is how to teach and learn anatomy via VR for nursing students to get them familiar to get them familiar to the exposure of the real life scenarios in clinical setting. Should I repeat that question?
No, it's absolutely fine. Okay, so real life scenarios, the nurses are not going to do dissection. If they go into a surgical unit, they are going to specialize in surgery, medical surgical nursing. So then the next level of training is due. So here, the anatomy is using 3D Organon, especially the dissection. If it was a cadaver, learning through cadaver, you have to know the inches and measurements of your scalpel cutting through the skin. But if it is 3D Organon, you can separate them without knowing the scalpel going through. So for real life scenarios, the nurses, this is a bachelor program. They are not ready for anything of real life by the first year. So it takes 4 to 5 years of training. Anatomy is just the beginning, basic health sciences. And then they train and then go to the real life scenario.
Great. An anonymous attendee, what do you like most in 3D Organon? What features you want to see in the future? That actually is a very nice question. And why I think it's a very nice question, I'll explain after you. Sorry, I do apologize. Sorry.
No problem. If you want, you have the
no, please. I'll just yes.
Because somebody is in flow, I like to leave that flow to them. Okay, so I would like to see if there is possibility of physiological features coming in. For example, the conduction of the heart, the cardiac cycle, how the blood flows in the heart, how the kidney filters the process, the function, not the structure alone, the function, how the kidney filters the blood and produces urine, the glomerulus working, how they absorb and release. So the functional aspect, I don't know how much technology can, maybe it can solve the issue. That's which I would like, physiology also.
Mm-hmm. Fantastic, thank you. What I would like to say here, and I do apologize again for jumping in, is, can you go back to the question for me? So yes, it's thank you. Is that every year 3D Organon releases a new edition. We're only a few weeks away from the 2023 edition. And within each year's edition, people will find amazing new features, functions, and tools. How do we introduce these new, amazing new features within the edition in our software? We rely on the feedback from our partners in the field worldwide. So that's a question, my honored attendee, that we ask our partners continuously. So we ask them, what features would you like to see? We cannot always promise in the future. We can always promise because we have to prioritize. There's only a certain thing, there's only a certain amount of things that we can do in each given year. But that's a question, as I said, we ask regularly our partners, what would they like to, and what we can do, what we can deliver, what we can offer, we do. So that's a very nice question. Thank you. Chris van der Voort is saying, directing this to you, Dr. Jobby, thank you for sharing your experience. And I thank you too, Chris, for attending. Anonymous attender is saying, what was it difficult to implement it?
Only one time, because of the lack of training. We were not sufficiently trained to manipulate the joysticks and do the settings or troubleshoot. Otherwise, it's easy to handle.
An attendee is asking, do you know other universities in your area to use 3D Organon or similar technologies? If not, what are the barriers?
I have not, because I had attended last time the first anatomy conference in Ajman University. So I presented this as a paper there. So they were all caught by surprise. Anatomy by VR, I think those attendees were new to VR. They have heard it, yes, but nobody has done it. So that's what is my feedback.
Mm-hmm. Yes, I can ask some of that too. Also, well, we are developing a presence in the Middle East region, which is a valued region to us. This effort only started last year, a couple of years ago. And in effect, we participated at the Arab Health last year with our distributor, Leader Healthcare Group there. We'll be repeating the same thing this year. So I'll be visiting the Middle East region next few days. So yes, we are seeing a lot of promise, a lot of interest from the Middle East region. We are heavily used. It's an untapped region still, with a lot of potential. The great thing now is that a lot of the professors are getting younger, right? And that could be, I could see that as a barrier, with all due respect to, and my professors at university, which must be very old now. With all due respect, as I said, they wouldn't have understood this technology if they were my professors and we had VR then. And at the age, the good thing in the Middle East, we're seeing younger and younger professors, as Dr. Jobby, people much more tech savvy, much more open to new technologies, and people who see the need for new technologies. This is a case for all over the world. Some regions more than others. So experience barriers, but the barriers are there to be overcome. So yes, we do have the University of Fujairah, where we have a few more universities in the region, and we are going strong. And we are heavily used in Europe, the US, and Asia and Australia. So Chris is asking to me, thank you for the webinar. Unfortunately, I have to leave. It was my pleasure, Chris, and I hope to hear from you again. Thank you. It was an honor. Thank you for your time. It was an honor our honor to have you here. Greeting from Belgium. Chris is from Belgium. Khaled Mashali, I hope that I pronounced that properly. Does 3D organ have pathologies?
As far as I know, it is only for anatomy, and the variations in anatomy, no. For example, dextrocardia, we don't have the variations, only regular anatomy, normal structures, no pathology.
There is a module in the option panel that drops when you're working on a model, which has like clinical correlations. It will provide a general view of conditions that are related to that model, that body part, that body system that's under investigation. We are looking into the possibilities of developing such pathology information in the future. I know it's something that has been requested. When and if, I cannot promise. So, but rest assured, we are looking at this. We are aware of these and of needs, requirements from the field. We're not in the field. Our partners are in the field. Almost, we're just shy of 500 universities, top tier universities in the world, from whom we rely on feedback, and we've been used by over 45, almost 50,000 individuals worldwide. Medical professionals, healthcare professionals, students, academic students, and so forth. And anonymous attendees asking, NBRU, oh yes, NBRU VR Anatomy and Abu Dhabi University, non-VRU, yes. I didn't want to mention any names before that, when I answered before about which universities. I don't think it was in my place to take the liberty of mentioning names. Yes, but I can confirm this statement, yes. So yes, there's quite a few questions there, which is fantastic. The more questions we have at the end of a webinar, the more rewarding I think it is. It really means that the webinar made a punch, right? It incited that interest in people. So what I can say here, I do hope, and I'm pretty sure that people having left the webinar today and Professor Jobby's presentation have explored a real treasure box of knowledge, of insight and experience. And I hope they come away feeling much more wealthy in terms of new ideas that they can create from your presentation, Dr. Jobby. So is there anything you would like to add, Dr. Jobby, if I make any closing remarks?
I would like to thank again 3D Organon leaders, all the members of 3D Organon. Ms. Tatania, she's updating me all the news, what's happening. Thank you very much, all the team, leaders. Mr. Federico is here. Thank you. He's the one who talked to me. Would you like to have a webinar? Yes, always welcome. So thank you again, and wish you a happy 2023.
Very important, yes.
Happy New Year to everybody. Thank you.
Okay, well, in turn, I would like to thank you from the bottom of my heart and to express our appreciation for myself and everyone at 3D Organon for your valuable contribution to our webinar series. I deeply appreciate your time and your effort and how smooth you made our collaboration. It was an absolute honor, Dr. Jobby. You made talking to you prior to the webinar, you made things seem very, very simple, which is always,
it means a lot to me because it's a big feedback and a positive feedback. It means a lot. Thank you.
Thank you. So I'll then make my just closing statements. Virtual reality makes it possible to bring together the missing pieces that makes any learning process truly effective. It's interactivity, engagement, and absolutely amazing visual representation. Virtual reality is rapidly becoming commonplace in nursing education and it has become clear that education providers are increasingly considering virtual reality to further enhance their nursing program delivery. Visit us at 3D Organon and explore how 3D Organon virtual reality is rapidly transforming standard anatomy teaching and learning, allowing both educators and students to visualize anatomy in an entirely new perspective. So once again, I wish to thank you from the bottom of my heart, both to Dr. Jobby and all our participants. I wish you, it's still very, very early in the year, so it's an infantile stage, so I wish you all a very happy new year, full of success, prosperity, all that you wish for yourself and your families, and most importantly, great health. That's the most important thing. And that's what we're dealing with, great health and medical education. So thank you very much. Take care until we meet again soon. Thank you and take care. Bye-bye.